There we go. So welcome to today's session. I'm going to be presenting today with Penny Lewis, who's also on the call, and Ross Atkinson, who is also on the call, is going to be doing the chat function, the Q&A function, sorry. So just bring my slides up. Okay, so thank you for joining us. I know today we've got a mixture of people joining us today. We've got people who are from the research departments in different organisations across Greater Manchester, and we've also got people who are potentially interested in applying, which is fantastic. So thank you so much for coming. We do have the Q&A function enabled. You can, I think, anonymously post a question if you prefer, or if you want to pose it verbally, you can wait till the end and you can just raise your hand and we can talk through any questions as well. So various options for asking questions. So I'm Rebecca McShane. I'm Programme Manager for Knowledge Mobilisation at the Applied Research Collaboration. Penny, would you like to introduce yourself?
Sure. So I'm Penny Lewis. I'm the Academic Career Development Lead for the NIHR Applied Research Collaboration.
Thank you. So Penny's going to talk through what is the ARC Greater Manchester, and then I'm going to do a few slides on the actual role itself, eligibility, how to apply, and questions at the end. So over to you, Penny.
Thanks, Rebecca. And good afternoon, everyone. Great to see you all here for this session. As Rebecca said, we're going to just give you a bit of an introduction to what the ARC is. And I know that we are all surrounded by acronyms left, right, and centre. I'm going to try my best not to use them, but hopefully this will explain the acronym of ARC. And apologies if you already know, about ARCs and what they do, but I think it's always good just to remind ourselves what the purpose is. So the Applied Research Collaboration Greater Manchester is one of 15. If you look at that little map there, we're the green one. We're very close to the Northwest Coast Applied Research Collaboration, which is why I can't quite squeeze in the words there. So there's 15 of them that have been funded by the National Institute for Health and Care Research, and they are a source of infrastructure funding. So you may or may not be familiar with all the funding that they offer in terms of individual research grants and personal awards for people wanting to do, I don't know, a PhD or development or clinical lectureships, etc. But this funding is actually for an organisation, and ours is the Applied Research Collaboration. You may know of other infrastructure funding like the BRCs, another acronym, the Biomedical Research Centres, and then we've got the PSRCs, another acronym, Patient Safety Research Collaborations, etc. So there's a few of these infrastructure, but our USP, our unique selling point really is that we are all about supporting applied health and care research that responds to the needs of the local area, and in our case, Greater Manchester. We may have alignment with some of the work that other ARCs do, but we're all about the needs of our actual area. So we will come together where we have shared priorities, but we are working with our local kind of organisations. We're also about implementation research, so about how we can basically improve the uptake at the rate at which research is actually applied in practice. Next slide, please, Rebecca. So we are led by the priorities that are already set across the health and care settings across the region. We are about co-production, so we don't just do our research in ivory towers and do what interests us as academics. We work with stakeholders across the care and health organisations, but we also work with patients and the public to understand about what we can do to respond to the things of greatest need in Greater Manchester. So we do a lot of co-production type work. Like I said, we collaborate with other ARCs where our priorities are aligned. We work with other universities, so we're not just Manchester University based. We work with Salford University, with Manchester Met. We work across all health and care organisations in Greater Manchester. Industry, various different public and communities of Manchester, mainly through different voluntary charity and social enterprise organisations. And like I said, our real USP is the fact that we are all about applied health and care research. So it's not the research that is sort of early kind of work. It's very much at the coalface of applied research and about getting that research that already exists into practice. Next slide, please. We have different research themes. So we have some core areas where we're really are interested in. And again, these map to the priorities of Greater Manchester. So unsurprisingly, digital health is a big area, economic sustainability, healthy aging, mental health, and organising care, all hot topics of importance in terms of improving health and care in the area. And then we have other themes that kind of cut across because they could apply across any of those. So evaluation, how we evaluate what we do and if that's working and how we can improve. Implementation science, patient and community involvement and engagement, and then my theme, which is capacity building. So they're the main themes. I'm not going to spend because today isn't about going into the detail of those. So we're going to put in a chat a link to our website if you want to know a little bit more, because all of those themes are listed on there, and you can find a little bit more about the different programs of work depending on what kind of interest that you have and what we do. Next slide, please. And this is our team. So you've met myself and Rebecca on the call. We've also got Alison Littlewood, who is our programme manager for our social care capacity building programme. And Ross is on the call as well, who's our capacity building programme manager. So that's us. Next slide, please. Oh, and this is where I hand over back to Rebecca, but I'm happy to take, I know it's a very brief sort of intro to the ARC, but I'm happy to take any questions sort of as we go along. Please do use the Q&A and I'll be around till the end. Thank you.
Thanks very much, Penny. So I'm going to tackle what is knowledge mobilisation. Well, it's an umbrella term for a process of a two-way process rather, to enable the right people to use the right information at the right time. So in this example, in this picture, we've got a bridge, the knowledge mobilisation bridge. And on the one side, we've got the research community, knowledge generation. And on the other side, we've got the health and care community, who are all about putting research into practice or evidence-based practice. So by knowledge mobilisation, what I mean is it's partly a communication process, but it goes one step beyond communication in the sense that it's creating new knowledge as a process of co-production. And as Penny said, the ARC is all about co-producing research with our partners and our organisations. So to give you a real life example of what knowledge mobilisation is, if I use my bridge analogy, say, for example, there's some new interesting research on the link between delirium and falls for old people in the community. The knowledge mobilisation process then might be to work with community-based older people services to think about, are they aware of this research? Does it link to what they're already doing? Who should know about this research? How could it be communicated to staff in the best possible way for them to understand the findings? And then discussions about, is there anything that we should be doing differently in practice as a result of this? Or do we need some more information, and could we feed that back to the research team and say, well, you've said this about the findings, but how do we implement that, and what is feasible? So in that sense, it's a two-way process. And the overall aim of knowledge mobilisation in this context is to make the lasting improvements in health and care. So at the ARC Greater Manchester, we have a pot of funding to increase capacity and capability in knowledge mobilisation. And what I mean by that is we want to develop new roles and new skilled staff out there in health and care practice to be able to do knowledge mobilisation effectively. So we're keen to support people, and the overall aim is to increase that visibility, accessibility, and use of evidence to hopefully inform services and how care is delivered, the policies that underpin that, and the practice of health and social care. Here we have the bridge again. So, what is the knowledge mobilisation role? Well, it's a part-time funded role for 12 months. There's backfill funding available from ARC Greater Manchester of a maximum of £20,000, including on costs. The champion role would be based within their existing employing organisation, but supported by their research department or who they work with, and also the ARC Greater Manchester through supportive networking with other knowledge mobilisation trained professionals, mentorship. They would be allocated a mentor, and they would receive peer support from other trainees, and a tailored training programme, which I'll speak a little bit more about. So the training that's available is really tailored to the individual. So it would depend on, say, the learning needs of that champion as to what was offered. So to give you examples, there are lots of videos and websites and short courses on knowledge mobilisation available. We've also got in-house training sessions in ARC Greater Manchester that are offered throughout the year, and there's a few examples of what they cover there. And that's to all of our trainees. And then we've also got access to training at the University of Manchester, which could include a master's level module as part of the clinical research masters on, say, for example, critical appraisal and evidence synthesis. That just gives you a flavour of training and support that's on offer for this role. What would the knowledge mobilisation champion actually be doing then? So the main part of it will be networking and building up relationships. And that's to connect those researchers and practitioners and decision makers together. There will be a lot of identification of what evidence needs, what are the evidence gaps in practice here, and how do we work collaboratively to fill those gaps. Then there would be facilitating of knowledge sharing activities and events. And potentially at these events, it will be about translating that research into clear insights so that, well, practical insights. What can we do as a result of this research? How can we use these findings in the local context? What makes sense for us? And finally, collecting some data so that we can monitor and evaluate and report on how knowledge mobilisation activity is actually impacting health and care. In terms of who can apply, the eligibility is a health and social care professional, and you can see that there's an asterisk there, and at the bottom it gives you more information. And we're using health and social care professional in the broadest context, and we've specifically ring-fenced this funding for certain trusts across Greater Manchester and organisations that we feel we would want to employ a knowledge mobilisation champion. In terms of the knowledge, skills and experience, we're looking for someone who's got great networking and collaborative skills. They can talk to people in different organisations at different levels and be flexible enough to adjust their approach depending on the feedback that they receive. We're looking ideally for someone who has an interest in or can interpret and translate research into plain language. And we do offer training in this, so don't worry if it's something that you feel like you need more skills in that area. We're looking for someone who would be willing to facilitate workshops and events to promote evidence-based decision making, so they'd have a real passion that would come through in that. Influential skills to guide and motivate other people to adopt those evidence-based approaches. Having problem-solving skills to overcome any barriers to evidence implementation. And finally, they would have existing networks within the health or social care sector in which they worked. So that's really a kind of person that we're looking for. In terms of the timeline for applications, anyone can apply from now up until the end of April at midnight is when applications close. Shortlisting decisions will be made on the 9th of May. And week commencing 19th of May is when we were looking to hold the interviews. The start date is any time from June onwards, depending on the individual circumstances. And final slide is about how to apply. So the steps are read the website guidance. There's a QR code there which you can scan, or there's a web link and it will take you to all of the guidance, the frequently asked questions, and the application process. Read through all of that. Link in with your research department to get that support with the application process. Talk to someone either in finance or the research team to calculate the costings for your particular salary to determine how many hours per week is feasible within that £20,000 window, and including on costs for your role. And then complete the application form. Now that can either be the online form or there is a Microsoft Word version if the online form isn't working. And finally, you will need a signed letter from your line manager and the research department in support of your application. And the form and the letter needs to be submitted before midnight on the 30th of April, as I've already mentioned. So that is the end of my slides. So it's over to you now for any questions you may have. If we can't answer your questions today, then please do feel free to get in touch with me, and I'll do my very best to get those answers to you. What we will do is any further questions, we will put them on the website as more FAQs for everyone else to access. And this video today will be available on the website as well. So thank you. Over to you then, Ross, for any questions that have popped up in the chat so far.
Thanks, Rebecca. We don't have any questions so far, so I would encourage people, if you want to put them in the Q&A section of the chat, you can do, or if you want me to raise your hand and ask them now, that's absolutely fine.
There is a question in the chat, Ross, just popped up from Alison. Can more than one application be submitted from one organisation?
Absolutely. We want as many applications as possible to come through from those organisations. So don't hold back with just the one. Thank you. Do you want to come off mute, Alison? Yeah.
Yeah, just another question. You know the module about critical appraisal and evidence synthesis. Can that be offered for anyone that's maybe not on this scheme? Sounds interesting.
I'll send that to either Penny or Ross, that question, because you deal with the rest of the trainees.
So as it stands at the moment, you'd have to be one of our kind of award holders or one of our champions, because if you get awarded that position, if you like, for want of a better word, then you get with that sort of access to some of the university training. We have to sort of bring you on board in terms of having an ID. That means you can use our library services and get access to all that. So it's not something that I think at the moment we would spread more widely than what we can do. Would you say that's right, Ross?
Yeah, my understanding at the moment is that if you are sort of signed up with the university as part of our programs, you get access not only to that as an audit-only access module, which you could do the module, access the module content without doing the assessment at the end. But we, as part of our programs, provide that funding if you want to take the module formally. We can make some more inquiries actually with the university to see whether there is an allowance for people to take individual units as an external candidate. But I'm not aware of that anybody's done that. I'm more aware of people who do a sort of series of units that are part of a qualification like the full masters.
Thank you.
Yeah, so there is like a unit fee for each unit. You can log, as any member of the public could go on and apply to be part of that course. And I think, it's around about £1,000 a unit at the moment. So that would be sort of obviously available. And if you did though, Alison, if people came to you and said, I'm interested in this, and we can give you a bit of insight into what that course might look like and what other it's because there's a few going on. As you can imagine, the university is really large. There's a few sub courses that I know that our health and care award holders have found really useful.
Thank you.
Great, thank you. Sarah.
Hi, possibly silly question. I was just wondering, would the remit of the role cover all the different research themes that Penny mentioned at the beginning, or would it be specific to an area?
That is a really, really good question. Thank you for asking that, Sarah. So the research themes in the ARC are really the research that we specialise in, and that's partly due to our expertise and also the needs of Greater Manchester. However, when we say translate research into practice, we mean research in the broadest possible sense. So not just ARC research, it can be, any research and evidence out there in order to inform practice. Obviously, we do have the ARC research, but it's not limited to that in any way. Does that answer your question?
Absolutely, thank you.
Thank you. Judith.
Sorry, is it my turn? Sorry,
It is your turn.
I've got a bit of a problem because I've got the phone on at the same time.
Yeah, I can hear a little bit.
Do you get the echo? Is it just me?
Yes, there is a little tiny bit of echo, but if you're okay with it, we're quite happy to hear your question.
Take somebody else first. If there is, I'll sort myself out.
I'm not sure we've got any other questions, but I've noticed that Alison, you've put in the question about what pops into your mind when you think about the knowledge mobilisation champion role. Alison's put a great initiative, as it's been a known struggle for the majority of staff to pay attention to research output from others. So thank you for that, Alison.
I'll give it a go. Sorry, I don't have access to the chat, so just bear with me. A couple of quick questions. Are you sharing a recording or the slides of the call?
Yes, it will be available on
lovely.
the website as soon as we can
and then
upload
for
that.
local authorities, we don't have an R&D department.
Okay. Are you a research lead in sorry, are you from which
local
organisation?
authorities don't tend to have R&D departments.
Yes,
as far as I know.
So do you have a research lead at all in the organisation? You're just on mute, Judith. Sorry, I can't hear you.
Yeah, no. No, I don't think that role exists formally, but obviously within public health we have that strong interest, and I think informally we would probably be seen as the obvious people to lead on research, and we are trying to establish ourselves as that, if that's a good enough answer.
Yeah. I mean, one option could be if there's no research department support, we could offer that support ourselves. So you can get in touch with myself and any potential applicants. I can coach and support them through the process. Ross, did you want to come in on that?
Yeah, so just to mention that we've had a couple of people from local authorities on our programs as well. So from our pre-doc and internship programs. So we can work with the local authorities direct to understand. I think maybe Judith, you're thinking about the application process and who signs these sorts of things off. I think the key things would be that we've got an estimate of the finance, the costings for that. Yeah, and then the line management, so somebody in a position of authority for that particular member of staff who's happy to support that member of staff with the application. So we can work with you to complete that.
Yeah, no problem.
It's an important question.
interview-
Thank you, Judith. Go ahead.
Yeah, I thought I wouldn't be on my own with that. And then in terms of the interview timings, because I think that will fall into annual leave of some of the people that I know are interested. Is that an issue?
No, we'll be more than flexible. It's just that sort of timeline for interviews, but there's always instances where people can't make the allocated time. So we would rather make sure we can interview everybody.
Okay, great. Thank
Yeah,
you.
be flexible. Thank you. Jamie, over to you.
Hi, I'm from Bolton. Yeah, I've got probably two questions. Is it a particular day that you'll be thinking? I mean, obviously it depends on, I suppose, the funding and how many days you can be released for. But will there be specific days you're thinking, or I'm just thinking about other roles and kind of if people are kind of signed up for something else. That's all I'm wondering about. And then my other question would be about how many are you actually looking for? Are you looking for one in each of the areas that you've mentioned, or just a general, how many people are you kind of looking at taking on in the program?
Thank you, Jamie. Some good important questions there. So we're very flexible about which day of the week or days of the week it falls on. So that's not going to be a limiting factor if you've got something else ongoing. We're looking for 2 roles in the first instance for the next 12 months, and then we'll probably be recruiting more of these roles because we have more funding.
Brilliant, thank you.
Thank you. Anybody got any other questions?
So, Rebecca, there was a question in the chat from Heather who may have had to have left by now, but she wondered if there is a crossover with the local authority public health practitioner, LARP, as the role sounds similar. Can people apply for this if there's also a LARP in the team?
Yes, there is a slight overlap. I've been in touch about the LARP role, and it also seems very interesting. So I guess if somebody does work in local authority, they have a choice of whether they want to apply for this type of role or the local authority LARP type of role if that is available within your organisation. And I do know it's probably limited to certain organisations across Greater Manchester, as this role is as well. So it would depend on whether there was the funding available. But yeah, it's a really valid point, and that the 2 opportunities are there for local authority staff. Does that answer your question, Heather? Oh, sorry, she's left, hasn't she? Right, okay. She already left.
She's gone, but I think somebody from the same organisation is on the call, so can feedback.
Okay, fabulous. Hi, Amanda. Thanks for joining us. The recording will be available after this session, so don't worry that you haven't seen the presentation. Did you have any questions you wanted to pose? Because we're just coming to the end now.
I know, yeah, I'm really sorry I missed the meeting. I really wanted to attend. No, if you could send me the slides, that would be perfect.
Yeah, we'll do. Absolutely.
Okay. Yeah, we've just started a new initiative within the R&I department of NIHR, and it's for research champions. So we had our first meeting last week.
Oh, fabulous.
We had a couple of enquiries about the knowledge mobilisation. So that's why I wanted to attend, but unfortunately my days ran over already.
No problem at all.
But I'm sure the slides will be fantastic. Thanks.
Yes, I'll say the recording will be uploaded to the website, and for the people who, if you do want a recording sent to you directly, would you mind putting your email address in the Q&A bit?
Yeah, of course I will.
Chat's disabled at the moment, but if you put your email address in the Q&A, then I'll make sure that I emailed the link to the recording to you directly as well.
Perfect, thank you.
Ross?
Yeah, just to pick up on Amanda's point, thanks for mentioning that, Amanda, because I picked up on that this morning from one of our interns who I think is one of the research champions at NIHR. So it's good that there's some cross-fertilization going on. So it's really good to see.
Yeah, fabulous. Okay, well, if there's no further questions, I'll close today's session and thank you very much for attending. If you do need to get in touch with me for any further information, then you can contact me on my email address. And thanks for joining. Have a good rest of the day. See you all later. Bye-bye.
Thanks.
Thank you.
Bye.
Thank you. Bye.
Thank you. Bye.